But first this evening, a first-hand account from those two local nurses who traveled to New York City to be there on the front lines of the coronavirus crisis, trying to help patients.
They say South Florida still needs to take this pandemic seriously. WPTV's Ryan Hughes spoke with both women and explains one of the nurses is now recovering herself.
It is a true crisis.
Quinn Hazellief and Julie Franklin, two nurses from the Treasure Coast, forever changed after traveling to New York City to help and treat the scores of patients battling the coronavirus.
It's very real. In some areas, it's very, very real, and people are dying. They're dying in truckloads, literally truckloads of bodies. And when you see it, it scares you for the rest of your life.
Julie assigned to an overwhelmed hospital in Queens, and Quinn a hospital in the Bronx.
You don't have the equipment you need. You don't have the resources you need. You don't have the people that you need.
The nurses say the hospitals were more overrun than you can imagine. Patients sitting in chairs for days because no beds were available.
I had 7 patients, one shift. And 5 of them were on ventilators, which is, the highest acuity I've ever seen.
Both women exposing themselves to the virus to help others. And about 2 weeks in, Quinn felt a tickle in her throat.
I had very good PPE while I was there, and I still got coronavirus. And I've been sick for 2 weeks now.
As South Florida takes small steps towards reopening, these nurses are warning everyone to continue to take this virus seriously.
I just hope people, approach it with some caution, if not to protect you, then to protect your family, or to protect your neighbor, to protect, the old lady down the road from you.
And both nurses remain in quarantine after arriving back home a little earlier than planned. Quinn is still recovering from the virus. She needed breathing treatments, but she considers herself very lucky. Ryan Hughes, WPTV, News Channel 5.